collected by the Oral Health Foundation and show that thousands of people in the UK were diagnosed with mouth cancer last year, which has increased by over a third compared to 10 years ago, and there's more than doubled within the last generation. Now, the research comes as that of the mouth cancers are found on the tongue. Some are found and are discovered on the tonsils itself. Now, these figures have been collected ahead of November's Mouth Cancer Action Month, and it's shown that there is lack of awareness around mouth cancer itself. So here to raise awareness around mouth cancer and also highlight Mouth Cancer Action Month is my guest, Dr. Nigel Carter, OBE. He's the Chief Executive of the Oral Health Foundation, joins me right now. Nigel, welcome to Gateway 97.8, and thank you for joining me today.
It's a pleasure. Good morning, Aston.
Good morning, Nigel. So I have to say this is quite alarming, especially now that we're in the month of November and it is Mouth Cancer Action Month as well. And some of us are not diagnosing cancer quite easily here, or not finding out cancer quite easily, especially in the mouth area.
It's a real challenge. We've been running the Mouth Cancer Action Month campaign now for 22 years in association with our sponsors, Demplan. And we started off and there was a really, really low awareness of mouth cancer. It has improved a little, but then it's very difficult if people don't even think about mouth cancer existing to start to teach them about the risk factors and the signs and symptoms that they might get in their own mouths.
Now, I mentioned right at the beginning here, Nigel, that one thing that's happened here is that some of them that are being diagnosed with mouth cancer or about to get diagnosis don't know exactly, but they can appear on the tongue as well, which is quite interesting here.
Yeah, absolutely. I mean, any area of the mouth can be affected. Very commonly, the tongue, the floor of the mouth, towards the back of the mouth and into the throat. Those are the most common areas. But people just don't think about the soft tissues of the mouth being somewhere that you can get mouth cancer.
Indeed. Now, with that being said here, what's also concerning as well is that many people do not know what to look out for. So would you like to explain what they need to look out for if they've got signs of mouth cancer or might have mouth cancer?
Yeah, three main things to watch out for. One is ulcers that don't heal within a space of about 3 weeks. So ordinary mouth ulcers, if it doesn't heal, that's a bit of a warning sign to get it checked out and looked at. Any unusual red or white patches, particularly if they're changing shape or moving at all, and any lumps and bumps in the head and neck area. Also persistent hoarseness. Now, these are all reasons to get along to your dentist and get checked out. Now, we know people have difficulty perhaps in finding a dentist these days. If you can't get along to your dentist, get along to your GP, and that early visit can save your life, because the real problem with mouth cancers, partly because, as you said, Aston, people aren't aware, is that they're diagnosed late, and as a result of being diagnosed late, the outcomes aren't as good. So we really need to get people aware of what's going on in their own mouth and to get along, get it checked out, because that could save your life.
Now, for our listeners that can't get to like their dental practitioner here, Nigel, can they also check for signs for mouth cancer at home as well? Because this could be quite interesting for our listeners as well.
Yeah, absolutely. You can have a look in your own mouth. You've probably seen how your dentist does it. I mean, pull your lips down, have a look at the cheeks inside, and the tongue, wiggle the tongue side to side, see if there's anything going on. And if there's anything that you're not sure about, do get along and get it checked out, because in fact, what has happened there is that you really need to catch these things early. So be persistent. You know what's going on in your own mouth. If something doesn't feel right, really get it checked out.
Another factor here, Nigel, obviously we're going through the cost of living crisis at the moment. That's also affecting many people in different ways, of one way or another here, and one which is oral health, and it's shown that people have avoided making a dentist appointment because they can't afford this as well, and which is not great really on the dental industry here.
No, I mean, we have a really a perfect storm in dentistry at the moment. We had total shutdown of dental practices for 3 months in COVID. At the beginning, that led to probably 9 million missed appointments. And then we had reduced working for the next 18 months because of increased cross-infection control that was necessary around COVID. So we now reckon, I mean, it's very difficult to tell, but probably 15 to 20 million missed appointments. So dentists have got a huge backlog trying to catch up with those, which then makes it very difficult for them to take on new patients. And at the same time, we have less dentists coming in from abroad. So we've got a real manpower crisis, which at the moment the government doesn't seem to be showing any willingness to actually look at that and make arrangements to train more dentists.
Another sad point here as well, Nigel, as well, with those that are being diagnosed with mouth cancer, the fatality rate is quite alarming as well, when figures are quite alarming on that as well, that over 3,000 people sadly lost their life due to mouth cancer within the last year. And the death rate by it is up by about a fifth in the last 5 years. And that's sad to see this figure come out.
It is sad to see that really ties in with the fact that obviously people don't die in the year that they're diagnosed. And it relates to the fact that we have seen this huge increase in the number of cases over the last 10 years. And unfortunately, due to that late presentation that we've been talking about, then more people die than we would like to see. There's a little bit of good news in terms of the fact that some of the increase in the number of cases is down to those that are caused by the human papillomavirus, HPV, which is the same virus that causes cervical cancer. Now, those tend to do rather better and survive rather better, but we're still looking at the majority of cases caused by tobacco use, smoking, chewing tobacco, and also by excess alcohol. Now, those really aren't changing. So we need to get this early diagnosis in, get people carrying out their own mouth checks, and if they're worried, get checked out.
So, Nigel, do you have any advice for listeners here on what they can do to check for vital signs if they've got mouth cancer here, but if it's an early stage, if they've got it as well?
Well, certainly look at those risk factors, cut down or cut out smoking if you can, reduce the amount of alcohol, be aware if you're at risk from HPV, that's if you're particularly sexually active, but take a notice of what's going on in your mouth. You know, we examine for breast cancer, we examine for testicular cancer. Why shouldn't we start looking in our mouths? It's very simple. It's an area that we go into every day. So you don't forget to clean your teeth. So actually go in there, have a look round the mouth, say at least once a week, see if there's anything unusual going on. And then that's a trigger to get you along to the dentist or the doctor.
So, Nigel, would you like to give out the information to our listeners of where they can find out more of what we've been discussing today and how they can find out tips and tricks about looking for mouth cancer in general?
Yep, you can go along to our Mouth Cancer Action Month website at mouthcancer.org, and you can also go along to the Foundation main website at dentalhealth.org.
So, Dr. Nigel Carter, OBE, Chief Executive of the Oral Health Foundation, thank you for joining me on Gateway 97.8 today to remind our listeners on checking on mouth cancer ahead of Mouth Cancer Action Month.
It's been a pleasure, Aston. Good to speak to you.
Dr. Nigel Carter, OBE, there from the Chief Executive from the Oral Health Foundation there, discussing more and making us aware that a lot of us need to check about mouth cancer ahead of Mouth Cancer Action Month.